Hi, my name is Courtney, and I've been caring for Miss Vivian Knock, who is a 68-year-old female with no known allergies. She came in 4 days ago with complaints of abdominal pain. She has actually been seen in the emergency department 3 times in the past 6 weeks for stomach pain. She had surgery yesterday for a possible bowel obstruction, and the surgeon found that she had colon cancer stage 3. She also has a history of colon cancer in her family. Her mother died at the age of 67 due to colon cancer, and her sister is currently battling breast cancer and receiving chemo and radiation as well. She has been A&O times 4 for me. Her vital signs are completely stable. She has been slightly tachypnic, but I do believe that is from her anxiety and about everything that's been going on. She did have a Foley in place, but that was removed and they put a PureWick in for her to use. But since the doctor has orders for her to get out of the bed, I've been encouraging her to go to the bathroom. She is working with PT/OT. She does have a colostomy bag in the left upper quadrant. And the stoma is moist, red, and budded. And she has had serous sanguis drainage in the bag. She has had complaints of pain, and so I did give her some hydrocodone, 10 milligrams PO this morning. She says her pain is at a 4 at rest and 7 to 8 when she's moving. She is in PO with minimal sips. She does have an NG tube in that is on intermittent suctioning, and she has had about 30 milliliters before I got here of dark green fluid with no odor as the output. She does have a fear of falling, so she's very cautious when she ambulates, and her friend, who she will tell you about, broke her hip and is now in a nursing home from falling. She has had no complaints of nausea for me, but she does have Compazine ordered if she does have that. As far as her skin goes, she has blanchable arrhythmic area on her sacrum, and she has a Braden score of 15, and the area around the stoma looks great. No abnormalities. She does have normal saline running at 75 milliliters an hour. The doctor is recommending that she have chemo and radiation to make sure the cancer didn't spread. The patient really wants to go home, and so I understand that, and I'm recommending that palliative care is consulted with her. She's been talking to me multiple times about how anxious she is. She doesn't feel like she can handle this. I did a palliative care assessment and her score was a 9. I also did the ESAS and the score was a 55, as well as the PPS, and she received a 20%. Her husband stays with her at night, and her daughter, who is divorced with 2 kids, stays with her during the day. And so she won't be able to fully care for her daughter or care for her mother because she does have the 2 kids. And the patient doesn't feel that her husband completely understands everything that is going on, which I think is causing her more anxiety and depression about everything. So I am definitely recommending that palliative care is consulted, and I also think it'll help manage her pain too. I also recommend that an advance directive is completed while the patient is still A&O times 4, and it will allow her to tell her family and the healthcare providers what her wishes are and what she would like to be done at the end of life care. And because the patient is very anxious and depressed, I think having the family attend educational sessions about her colostomy and how to properly care for it will allow her to feel better about the situation and the support that they can offer her when she goes home. Other than that, I think having the chaplain and spiritual care involved is going to help Miss Vivian feel a little bit more at peace with things and also allow her anxiety and depression to calm down and her realize that it's okay, everything's going to be all right, and she will make it from here with her family support as well as her church support.